Does traumatic grief cause feelings of detachment? Does traumatic grief lead to feelings of detachment? The answer is yes. Traumatic grief is the intense and prolonged grief that follows a sudden, unexpected, or violent loss. This type of grief often overlaps with symptoms of post-traumatic stress disorder, commonly known as PTSD. One of the key symptoms of PTSD is a sense of detachment or emotional numbness. This detachment can feel like being disconnected from oneself, others, or even reality. People often describe it as feeling unreal or emotionally cut off from their surroundings. When someone experiences traumatic grief, they may exhibit several symptoms. Avoidance behaviors are common, where individuals steer clear of people, places, or activities that reminded them of their loss. This avoidance can reinforce feelings of isolation and detachment. Emotional numbness is another symptom, where a person may struggle to feel emotions or feel as if they are emotionally shut down. This response is often a protective mechanism against overwhelming pain. Additionally, a sense of unreality or dissociation can occur. This is when individuals feel detached from the world or themselves, sometimes feeling like they are observing events from outside their body. These symptoms arise because the trauma of the loss can overwhelm the brain's normal processing of grief. This triggers PTSD-related responses, such as hyperarousal, intrusive memories, and avoidance. The detachment acts as a coping mechanism to lessen the intense distress caused by traumatic memories and emotions. Clinical descriptions of PTSD following bereavement often highlight that individuals may experience a sense of detachment and unreality, alongside other symptoms like flashbacks, nightmares, and hypervigilance. This detachment is part of the negative changes in cognition and mood that characterize both PTSD and traumatic grief. Moreover, traumatic grief can involve a persistent yearning for the deceased, difficulty accepting the death, and withdrawal from social or daily activities. All of these factors contribute to feelings of isolation and detachment. In terms of treatment, addressing traumatic grief and its associated detachment usually requires therapies that focus on both grief and PTSD symptoms. Trauma-focused cognitive behavioral therapy is one effective approach. These therapies help individuals process their trauma, reduce avoidance and detachment, and rebuild meaningful connections and activities. In summary, traumatic grief often leads to feelings of detachment, which is a recognized clinical feature reflecting the brain's response to overwhelming trauma and loss. This detachment can be addressed with appropriate mental health interventions. Always remember to consult with healthcare professionals for personalized advice and support.